Casimiro here.
Thank you. I have a question for Professor Gibrati. We are aware, and it's well known, the effect of disasters on zoonotic disease and other infectious disease. How much we know about the effects on non-communicable disease, and how much is studied, and actually how the One Health approach can be a solution for that. What the One Sustainable Health for All Foundation, we are producing operational sheets on One Health approach in disaster risk reduction. So I would like to know your point of view. Thank you.
You said operational?
Sheets for analysis. Sheets. Sheets, yeah. Like protocols on One Health approach in disaster risk reduction. And this is what our working group on humanitarian action is developing this tool.
Right. Should I? Sorry.
Yes, of course.
Just to give you a short answer, because you've asked a question that is quite vast in its implications. The truth is, the humanitarian community, right, who react to climate disasters, to the floods and so on and so forth, it's a very limited, they have a very limited horizon, right? Their role is to go and succor the population, to help the population in the short term. That is their problem, because, and that's linked also to the funding of humanitarian aid. The funding of humanitarian aid has a very short window. So you have to spend the money. By and large, it's changing slowly. You have to spend the money in 3 months, and then they renew it in maybe another 3 months. So in 6 months, you should be finished with your job and you're out of there. That's humanitarian aid in natural disasters. Now, for the operational protocol, I'm just taking bits and pieces of here. So for the operational protocol, that has improved tremendously in the last 20 years. Operational protocol for even WHO, which the Department of Humanitarian Health, of Emergency Health, has become huge. And they have very good protocols, but they are still limited by the time factor. Whereas now, with climate disasters, we find that the time factor is a handicap, because much of the impact comes really after 6 months, 9 months, a year afterwards, including disease transmission, including undernutrition or, bad nutrition, very simply malnutrition. That's what it means, as Antoine said. So I think what has to change now is to realize that, yes, that there is the time factor is an important factor, that climate disasters have important changes in ecology, environment, and animal health, in livestock, and those things have to be packed into the protocol of response. Yeah.
Professor, since you are actually talking about this moment, people arrive and they treat the crisis, actually, I would like to address another problem, another topic with you. That's the lack of information, the lack of data that you have. As you said, you arrive there on a disaster, you try to help people, you have a small window to do it, and then it happens to be that nowhere you have the complete data set. So probably this timing is an explanation, but that's not the only one.
Yeah, so my biostat professor, my biostat professor, I have to learn from Madonna,
Yes, that's the Madonna. Next time, if you want, you can have one. That's the Madonna. I will have one for you next time.
So my biostat professor in the first year of my university at Hopkins, he came onto the stage. It was a very big class. And he came onto the stage and he said, he looked at us and he said, "In God we trust. Everybody else must bring data." So I think it's something that's stuck in my head.
I like this one.
Something that's stuck in my head. And I think for climate disasters and relationship to human health, livestock health, animal health, and plant health, if there is no strong evidence base, which my two colleagues here have mentioned, for certain areas, the evidence base is very strong. Why? Because money is involved. Money is involved. Pharmaceutical companies need the data because they're going to sell their product at huge margins, right? So money is involved. So suddenly you have the data. For the impact of climate extremes on human health, data is very scarce, systematic data. You can have it for one country, for Mozambique. You can have it for Belgium. Belgium, this is a rich country, this is not a problem, the floods, you can have data. But you don't have anything at a global scale. What you have at a global scale, and this is an important concept to keep in mind even for what you have at the global scale are discipline-specific data. So what do we have? We have the MDAT data, which Vanessa mentioned, which I founded 30 years ago. You have the disaster impact on human populations. You have environmental data, Max Planck Institute in Jena. They keep environmental data on all climate disasters. Socioeconomic data, Radboud University in the Netherlands, they keep So each one of them have these silos of data. And until we break those silos, not only for climate disasters and human health, but for almost any other area of science, unless we break the silos, we will never get a One Health concept. That will not work. That will not work. And somehow scientists have to be convinced, and it's not very easy, scientists have to be convinced to share their data.